Hi, this is Randy Grill, DDS of Nursing Home Dentist. Today, I'd like to talk about nursing home fillings. We have several choices. One are silver amalgam fillings, uh, the cosmetic, plastic fillings, and a more temporary that the World Health Organization calls intermediate type of filling called, we use the brand name Fuji 9, are the three type of fillings that we can consider in a nursing home. Silver amalgams I haven't done for years because of the mercury flap, but also I found out years ago that most of my patients need profound numbing because the way silver fillings are, you have to cut retention in the tooth to hold it in or they'll just pop right out. So you have to drill deeper, you have to spend a longer time in there, you have to use a high speed, which we have missionary dental equipment. We have to use a high speed, which one of the things that I have found the difference between doing pediatric dentistry and geriatric dentistry is nothing. What's the difference? The difference is in age, and the difference is a child cannot say no. If the POA, the power of attorney, is there, if the POA is there and is willing to force things to be done, it's easy to do. The injuries are seldom. They're elastic, their jaws you can prop open, they don't hurt, they don't get TMJ injury. Now, I haven't done pediatric dentistry in years, but that is my understanding still today. In geriatric dentistry, if I had the jaw propped open and I'd done a risk-reward ratio, a lot of my clients who are above 80 females, I have younger clients, but if they're in a nursing home and they're Medicaid and Medicare, which are 99% of my patients are both on Medicaid and Medicare, they are certified to be in a nursing home. Nobody's just paying for them to be there. There's a reason the doctors want them there. So they have to be cared for 24/7 by nursing care minimum staff. And so they have challenges. Some of my greatest challenges on my younger patients are my mentally retarded MR kids or adults, Downs, but my Huntington's chorea, MS, and CP, cerebral palsy. Also, they're younger, but their bodies are just as fragile as some of my 80-year-olds. So by definition, I can't say not everybody's alike, but I can make a generalized statement that most of my patients cannot have silver fillings. It's too dangerous to numb them up to the levels they need. They have too many challenges. With epinephrine, you can't use that, which is in a lot of anesthetics, and those that don't have them have challenges. And then they flat can say no in the middle of an injection, and you got to write it out like a Breckenbach, like a bull rider for 8 seconds, so you can gently get that needle out and no injuries done. So amalgams, very few of my patients would tolerate that, could tolerate it without injury, a minimum of TMJ injury. Our regular cosmetic fillings, one of our biggest challenges we found out, if you don't use a rubber dam, and the rubber dam clamps on my patients would extract a large number of teeth, and they would also crumble, crack, necessitating crowns, because the teeth are crumbly. When you get to the nursing home care stage, and everybody's age is different, but their medical age is high compared to general practice. So this isn't like general practice. I never had to worry about extracting a tooth with a rubber dam clamp. Cosmetic, plastic fillings need total isolation from saliva. You can't bail out in the procedure or the filling is ruined. You can't get water on it. So yes, I do have a chance to use the cosmetic fillings once in a while. The plan doesn't pay for cosmetic fillings, but I mean cosmetic type filling. So that leaves what the World Health Organization calls their intermediate filling, which lasts 4 to 6 years. We use Fuji 9, and if mom or dad or your loved one bails out on me, the down and dirty technique is I can roll that filling material and ball and thumb it in, and they are not worse than they were when I left them. I'm not leaving a hole. I can do it in 2 seconds if I have to bail out. Now, that is what I have to think like. Okay, if we have to bail out, what do you do? Well, with a silver filling or a cosmetic filling, you leave a big hole there, which if they let you back in, they're worse off. They'll start experiencing pain. Uh, it, it goes on and on. Where with the Fuji 9, 99% of the time, I can leave them better than they came in on. After I remove the decay, we mix the filling, preferably, we're able to shape it, we're able to form it, but it all depends on mom and dad and their mood, how tired they are, different things going on. Now, if you're there, they're always good. Rarely do I have anything happen when you're there. So, most of the problems happen when you're not there because they need that familiar voice. Even the staff can't comfort them sometimes. And we're talking about an age group that if they want to say no, by George, the state makes sure they can say no, even on important things. And we're not talking about opening them up and they bail out of a heart procedure because they're asleep, and you've already done the risk reward ratio on that. So we do a lot of fillings. We love doing them, but we do a filling that lasts 4 to 6 years. And one of the reasons for that, if you look at the statistics, my mom lived 3 months in a nursing home once she got to that stage after assisted living and after living with us for years. Others, I have a few that have been in care for 18 years. They're exceptions. And if on one of those I did a filling and after 6 or 7 years it popped out, I just redo it, get another 6 to 7 years. But the statistics in my practice, in my age group, in Kansas and Oklahoma, is mom or dad are probably not going to be in the nursing home over 4 years and probably not over 2 years. That is not a blanket statement. That just says probability, possibility. And we have to assume they're going to be there a long time. But if the filling pops out, we just redo it. It's not a big thing. It's easy to do. If they bail out and water gets in it, I can just quickly dry it off, get a filling in there, and they're better off than they would have been. So that is nursing home fillings, and I'm Dr. Randy Grill of Nursing Home Dentist. Thank you very much.